Hello, welcome to our frequently asked questions. Today I'm answering a commonly asked question about blepharoplasty. What is the recovery after blepharoplasty? Well, when thinking about this question, there are really three elements to what is the recovery after blepharoplasty. There's the first element, which is your general time off work. There's the second element, which is more specific to certain circumstances, such as exercise, using contact lenses, special events. And then there's a third element, which is what can be done to enhance your healing and speed up your recovery. My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon. And blepharoplasty, well, it's one of the commonest procedures that I complete for patients every day. And the information that we're talking about today is information that I share with my patients and hopefully will help you. So in terms of general recovery after blepharoplasty, well, for most patients, the recovery is 1 to 2 weeks. And in that period, the main things that affect healing are swelling and occasionally bruising. And most of those are largely recover over the first 2 weeks. And generally, swelling and most bruising, 80 to 90% will go over that 1 to 2 week period. So in terms of most patients, well, that is certainly the circumstances. The other elements, well, the factors such as the scar, well, the scar from upper eyelid surgery can largely be hidden in the natural crease of the eyelid. So even a week after the surgery, this can be relatively difficult to see. Now, it's fair to say that any scar can be a little bit pink, a little bit lumpy, bumpy a week after the surgery, and that is normal healing. But generally, because it's in the natural crease, it's relatively discreet, and with makeup, this can be hidden further. Now, in terms of the second set of circumstances, what in terms of recovery, in terms of exercise and using the gym, well, generally I would advise you having 3 weeks off before doing those kind of activities. And this gives plenty of time for healing to occur, and activity before this time can give you more swelling and a longer recovery. Things like contact lenses, well, for upper eyelid surgery, I'd recommend leaving them off for a week. If you have an important event, such as a wedding or large social gathering, well, generally I would recommend having a little additional time, and this enables you just a little more time to feel at ease with things. And in these circumstances, generally I'd recommend having at least 6 weeks before that important event. Another specific criteria can be your profession. If you work with a lot of HD cameras or video cameras and you're in a more performing arts type of industry, well, generally I would try and allow a 6-week period just to give you additional time for that final result to occur. In terms of the very final result from upper blepharoplasty, when all of the swelling is resolved and the scar has reached its final endpoint, well, this can be really many months after the surgery, and generally it's 6 to 12 months when the very final result is reached. And there are measures that can be taken to enhance recovery. So when we think about enhancing recovery, really there are measures that can be done during the surgery, there are measures that can be taken before the surgery, and then measures that you can take after the surgery. Well, during the surgery, well, surgical technique is definitely very relevant in this area, and there are steps that can be measured to reduce bruising, reduce swelling with the surgical technique. In addition, there are other additional procedures that can be completed at the same time. For example, platelet-rich plasma, which involves utilizing your own growth factors to heal the area faster. Well, in certain circumstances, such as using laser in addition to upper blepharoplasty, this can certainly enhance recovery. Things can also be done before the surgery, and there are certain medicines and herbal medicines that are best avoided before surgery. And to give you an example, there are certain agents that can thin the blood, such as fish oils, and there are many others as well. And I personally give detailed written information to all my patients to things that they should avoid before surgery to reduce swelling, reduce bruising, and enhance healing. Finally, there are things that you can do after surgery that will enhance healing. And this may be the use of ice packs or cold compresses in the first 3 days after surgery. There are also additional medicines that can be used that enhance healing, anti-inflammatory medicines. So I certainly give all my patients a prescription for medicines and advice on what they can personally do to reduce swelling after surgery. And some of these things can be cold compress, but it also can be sleeping position and keeping your head elevated after surgery in order to reduce swelling. So in summary, the recovery after upper blepharoplasty, well, for most patients it is really 1 to 2 weeks. And we've discussed specific circumstances in which this time frame may differ. And we've also talked about measures that you can use to enhance healing and speed up recovery. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.